two of the most recent healthcare law versions that were proposed. A lot of the benefits of the Affordable Care Act, Obamacare, that benefited the Medicare program, many of those benefits were not touched, were not addressed.
Yeah.
I know in the first version, right now I cannot remember the name of that version, but there was some taxes on high income earners that was going to be eliminated. And then the most recent version, the Graham-Cassidy bill, there was only one small tax that was going to be impacted, but everything else was going to be left alone. So in terms of Medicare coverage, the way that we're addressing this, looking at of the laws, is just pushing forward with what they currently are. In terms of marketplace coverage, people who do not have any other insurance through an employer or a government program, they need to be paying attention to see what's going on. In terms of positioning yourself, I really don't have a good answer for that one in terms of marketplace plans. Big changes could happen. There could be small changes. So we're just not sure. It's very volatile right now. So.
Yeah, being the current administration wants to really hack up the Affordable Care or Obamacare.
Yeah, health care is on the top of the legislative list recently, so lots of changes, lots of checking the news and emails at night to make sure we're up to date with everything and changes that might be going on. I don't think I really did a good job addressing that question, but in terms of Medicare...
Can we direct her somewhere that might give her a better answer?
I'm not sure.
We apologize for that.
In terms of Medicare, again, the Part Ds and the Medicare Advantage plans, these change every year. There's always going to be updates. So this has been a ongoing topic for these policies since their inception, especially with the Part D starting in 2006. Those policies they make changes every year, so it's recommended that people do review those policies.
I was going to say, would it be beneficial for them maybe to contact their local legislators?
If that's a good idea. If there are these programs that are benefiting people, and they think that program should continue, that's where you contact your legislator. If there's an issue that they think can be addressed and improvements made or other changes made, again, that's where you contact your legislator. That's where all this change is coming from.
Yeah, as I was always told, your best advocate is your own self, so.
Mm-hmm. Yep, that is true.
About the time you let the next person advocate for you, that's about the time changes are made and you didn't get a chance to make a difference.
Mm-hmm. Yep. So, we talked about extra help. So, prescription assistance, very simple application that our volunteers are trained at doing. The second low-income assistance program that we help people for is called the Medicare Savings Program. This is a Medicaid program.
I'm really interested. We actually can save.
Yeah, the primary focus of this program is to have the state of Michigan pay an individual their Medicare Part B premium. We didn't talk about this yet. I had it later on my list, but the Medicare Part B premium for beneficiaries is typically going to be automatically withdrawn out of their Social Security statement.
Right, right. I don't want to get too far off subject, but I see our Medicare is going up about 2%, or Social Security, I should say. So I was just wondering, is there going to be an offset of Medicare premium increase, or?
So an interesting topic that a lot of people are curious about.
Yeah.
Social Security Administration announced last week that there's going to be a cost of living adjustment for Social Security of 2%
Yeah.
for 2018. And what does that mean for the Medicare Part B premium? So for the vast majority of Medicare beneficiaries, their premium this past year was $109. The baseline Medicare Part B premium for 2017 was $134. Now, the reason why a lot of beneficiaries are paying this lower rate right now is because over the last 3 years we've had either a 0% increase, or last year it was 0.7% increase. So a very small cost of living adjustments.
Yeah.
There's a Social Security law that identifies if the Part B Medicare premium increases, a beneficiary cannot lose on their net income by having more money taken out for Part B. So people's income, Social Security benefit, was not raised up to that baseline $134.
Thank goodness. Wow, that's quite an offset compared to the cost of living increase.
Correct. Yeah, they don't. Yeah, they don't want to take more money away from people, even though these programs are raising their cost. The problem comes in this year with that 2% increase. That means people are going to see a $20 to $25
yeah.
Increase in their monthly benefit.
I already calculated it.
Yeah. Yep. The problem is, well, now that they have that much more income each month, that means their monthly premium, while it was held down low, can be brought back up to the baseline amount of $134.
Oh, I see. It's kind of done behind the scenes, so to speak.
Correct.
So we don't feel the crunch up front out of our pocket.
Mm-hmm.
I see.
So a lot of people who are going to see, who have been at $109 per month, or if they were new to Medicare in 2016, their premium is $124 per month this year. Their Part B premium is going to go up to $134.
Wow.
And that's going to result in most of their 2% increase is going to be absorbed by Medicare. So they're going to take that. So at the end of the day, they may only see a $1 or $2 increase in their Social Security benefit.
Wow.
But, yep. Based on Social Security law, Part B premium covers 25% of the expense for the program nationwide. General fund tax dollars cover the other 75%. So we have more people joining Medicare every day, about 10,000 people every day joining Medicare. Health expenses going up, people living longer, so there's more demand on the program. And so that helps to drive those prices up. And
in a general sense, our population is becoming more geriatric, or aging more or less.
Yep, and many of the counties in the region that I cover, the median age is going up. We have a much older population than we used to have.
Just because we can live longer due to modern technology, medications, and medical field in general, I suppose.
that, and better understanding of how eating right and activity keeps us healthy and we last longer, live longer. But yeah, back to that Medicare Savings Program. That is a Medicaid program that focuses on paying that Medicare Part B premium for somebody. It is a Medicaid program, so the individual has to complete a Medicaid application. Those can be more involved than, especially for the Extra Help program. The Medicaid requires that you provide verification documentation, proving your income, proving your assets, proving your identity, things of that nature. But again, this is a Medicaid program, so there are income and asset requirements for this program. To qualify to have the Medicare Part B premium paid for a single individual, the gross monthly income has to be below $1,376, and for a couple, $1,877.
Well, it's not a huge difference for single as opposed to couple.
Mm-hmm. And those are monthly amounts too that I'm
Yeah.
providing you. There are also asset requirements, so bank accounts, retirement funds, things of that nature. For a single individual, assets of $7,390 and below, and for a couple, $11,090.
That's not very much. It
No.
would take only one major medical issue and it would all be wiped out.
Correct.
It's like walking a tightrope almost.
Yep. Full Medicaid benefit for somebody with Medicare. Those limits are even lower. So for income, it's $1,025 for a single person. And for a couple, $1,373. And then assets, like you had mentioned earlier, have to be below $2,000 for a single and $3,000 for a couple. If they qualify for that full Medicaid benefit, Medicaid works well with Medicare in terms of when you have your Medicare coverage, you go to the doctor, the hospital, Medicare will pay first, and then what's remaining would be picked up by Medicaid and paid for
like
by Medicaid.
80-20 or something like that.
Correct, yeah, that 20% copay would be paid for. And this is true for both Advantage plans and Original Medicare.
Okay.
One of the issues that we've been running into recently are providers who are balance billing individuals. The term balance billing is if somebody has both Medicare and Medicaid, the provider is not supposed to charge them the 20% copay. Medicare will pay their portion and the remainder should go to Medicaid, where either Medicaid is going to pay it or based on various costs and laws that the cost would be wiped away, but the beneficiary should not be billed that amount. Medicare is improving their billing system to notice and identify full Medicaid dual eligibles quicker to prevent providers from billing them. Plus on their monthly or their quarterly Medicare summary notices, the documentation that Medicare sends out that shows everything that was billed to them, there will be a notice on there that says this individual is full dual and should not have to pay copays. So
I'll be the first one to admit I don't usually read it, so shame on me.
most people don't. Those are good, at least just to have for a little bit. If there's a service that you want to appeal, you're going to need that documentation to appeal that. Plus Medicare fraud is a huge issue going on right now, and anywhere from $45 to $65 billion a year is lost to Medicare fraud and abuse.
Really?
Mm-hmm. And reviewing those Medicare summary notices is the first line of defense for beneficiaries to see if any fraud has occurred.
I think our guest is telling us, everybody, don't put in file 13 before you read it.
Yeah. Yep.
And if you're just tuning in late, we are talking today with Bob Callery from MNAP. And if you still like to call in our last few minutes here, the number is 459-4881. That's 459-4881. What are the last few topics you would like to talk about?
So we talked about Part B, the premium.
Yeah.
It's going to absorb a lot of individuals' cost of living. That was an important issue. I want to go back to Part A of Medicare coverage. Part A is the inpatient hospital coverage. Part A will cover hospital stays if you are admitted to the hospital and identified as an inpatient status. When you're admitted, you can be either inpatient or observation.
Yeah, I don't want to steer you off subject here, but I saw reports on the news before where people thought they were inpatient, but they were admitted as outpatient. That really affected, their out-of-pocket expense.
Correct.
If I recall correctly.
Yep. Yeah, with Part A, hospital inpatient, if you're admitted, you'll have a $1,316 deductible that you would be billed from the facility. Whereas if you're in the hospital under observation or outpatient status, it'll be billed under Medicare Part B. So after your deductible at the start of the year, you'd be billed 20% copay. So, if we're looking at a hospital stay of $20,000, that 20% could be $2,000 for that stay.
Which is not a real big number depending on what you're admitted for.
Yeah, my math was off on there. That'd be $4,000.
Oh, yeah, you're right.
20%.
I won't count that against you. I'll be the first one to admit I was definitely not in the upper math class.
Yep. So yeah, they could be billed that $4,000 for that $20,000 hospital stay. The other big issue is with prescription coverage. Hospital facilities do not bill Part D plans, so you'd receive the full cost bill for your prescription coverage. But the individual can turn around and bill that to their Part D plan. But this really becomes important when we start talking about skilled nursing. So if somebody needs to go to a skilled nursing facility after their hospital stay, they need a 3-night stay in the hospital under inpatient status. So if they're in the hospital for observation, that's not going to count. So the beneficiary could have to face paying full cost for their hospital stay. Luckily, starting March 6th of this year, hospitals are required to provide a document called the MOON form, the Medicare Outpatient Observation Notice, and this would identify what their status is, especially if it's outpatient observation, and then the ramifications if they were to go to skilled nursing that Medicare would not provide coverage for that skilled nursing stay.
Wow. I do believe we have another question about Medicare.
All right, so this question is from Matt on Facebook. The question is, how does Medicare fraud happen and who is committing it? Medicare...
I'd just like to say that's a great question because I was thinking that same question in the back of my mind.
So Medicare fraud takes all kinds of forms. So some of the more scary things out there would be somebody stealing your Medicare number and fraudulently billing Medicare for services. It could be somebody in a doctor's office stealing a number. It could be even something as simple as if you carry your card around and losing it, losing your wallet on the side of the street. That Medicare number could be taken and fraudulently billed. Um,
I'm really surprised we haven't come to the point yet where we have a chip inserted in our finger or something like that.
Yeah.
But I guess that's a few years out yet.
There are schemes that are set up, and so you'll see this a lot on the news where there's
Yeah,
kickback
take
schemes.
advantage of the seniors type thing.
Mhm. Yeah, there'll be providers and doctors, and that they're working with each other to direct people to a certain service that they may not need, and yet they're still billing Medicare for it, and they're
So
reaping.
they're getting a kickback for
Correct.
it. Oh,
Yeah, they'll say for every person that you send, I'll pay you $100, and so they pay that money, but then they bill Medicare for thousands of dollars and getting all that money. So yeah, it's very costly. I mean, this, second part of the question was who's committing this. So you have in the news there are some doctors who've done this and other providers. There are different crime organizations that have done this, different groups like that. And one of the ways that Medicare is combating Medicare fraud and abuse is they are in the process of replacing everybody's Medicare card. So at this point in time, Medicare claim numbers are typically somebody's Social Security number. Well, starting next April, all the cards are going to be replaced. It'll take about a year for Medicare to replace everybody's card, but they're removing the Social Security numbers off cards and replacing them with 11 numbers and digits, randomized, sort of like a credit card. And so you'll start taking that with you to the doctor and using that for billing purposes.
Also, we can do away with those old blue and red cards we kept forever.
Yep, you'll be able to get rid of those. I would say hold on to it though.
Yeah, okay.
Providers, they still have to update their systems too in order to utilize those new numbers. And so Medicare is granting them a period up until January 1st of 2020.
Wow, that's a long grace period.
So there might be a couple of
Wow.
years there where your doctor's office may still be taking the old numbers. So hold on to those cards.
No, don't pinch them yet, folks.
Yeah, don't shred it quite yet. But once we reach January of 2020, then you can shred and destroy those cards. The new ones are going to look very similar. They're going to have a red bar and a blue bar on there. It's still going to have their name, this new number, and then the effective dates. So that tells us when Medicare Part A and B started for the person. So
Are they going to be like a debit card or more plastic so they're a little bit more durable? Or?
nope, it's still going to be on that cardboard. So
Oh, geez.
my thinking behind that is one for cost. That paper is probably
Yeah.
easier to cost. And the other thing was two for security purposes. If you put that on a hard plastic card, that number is going to be there forever. Whereas if it's on that cardboard, the cardboard will rub off and dissolve. So kind of a long-term safety feature, I guess. But
Yeah, I guess, I just don't think they'd deem it so. It's a thought, though.
Yep. So yeah, I mean we're losing lots of money each year to Medicare fraud and abuse, and so they're looking for ways to stop that.
Well, I would assume if they can, they'll help keep our out-of-pocket costs down as well.
Yeah, if you think all this money that's being stolen, that's money from, services. They have to increase the services, the money that's used to improve the program. I mean, it's a huge cost that's stolen out of our pockets. So any way to help keep our money for our program in place is good.
Yeah, anything that, help keep the costs down, because we all know it's only going to go up.
Correct, yep.
Before we go, I would just like you to briefly explain the volunteer program.
All right, so MAP, Michigan Medicare Medicaid Assistance Program, we are a statewide volunteer program that offers free and unbiased assistance for people with Medicare questions and reviewing various Medicare policies.
So basically, the consumers don't have to feel like they're getting a sales pitch.
Correct. At the end of the day, I really don't care what coverage you sign up for as long as it provides the coverage that you're looking for and best meets your financial situation. Whether that be through Original Medicare or Medicare Advantage plan or with any one of the various companies. We just want to try and connect you with what's going to best serve you. If individuals receive their Medicare and U book, those books have gone out. If they flip that book over, our 1-800 number is on the back cover. And that phone number is 1-800-803-7174. They can also contact your area agency on aging. We are able to receive calls that way, or local senior center. Many of our MAP volunteers are located in all those different facilities. Through the 9 counties that we cover in our region, we have about 90 volunteers that help answer Medicare questions and help people review their policies.
And there's quite a process they have to go through to be capable to do that as well.
Correct. Yep, our volunteers complete an online course, and then we have an in-person class. And then there's ongoing training and certification. We have monthly trainings, and they have to complete a certain number of hours every year to remain certified to continue volunteering for our program.
Well, looks like we are about due to wrap up here pretty soon, folks. I would like to thank Bob for coming in today and giving us your wonderful knowledge about the Medicare system.
You're very welcome. It's a complex system, it's a large system, and there are resources out to help people.
Okay, well, I think that's gonna about do it today for Scott in this system, and thank you very much for watching.